If you look at Africa, the picture I have described to you is a common picture in most of the sub-Saharan region. We also have almost a similar picture in the Asian-related countries. Of course, we are also seeing this issue of young people getting into pregnancy, into early sexuality behavior in the rest of the world, in Europe and America. But because their circumstances are different, the health effects are also different. The systems are different. But overall, if you look at how our health services are prepared to manage the issues, the sexual and reproductive health issues of the young people, Africa is beginning to think through a strategy which will help the African region improve their health systems for managing young people. But so is Asia, for instance. We have a number of examples of how Asia is trying to deal with some of the traditional issues, challenges which they have, like early marriage. They are also grappling with the same thing. And addressing their values is also a challenge, just like in Africa. Early marriage is a challenge, and exposing young people. But Africa also has harmful traditional practices for young people which we have to deal with, like female genital mutilation is a common problem here. Yes, and many African countries still have that. That may be a less problem, like in America and Asia. They are not dealing so much with that. So the systems have to be shaped around the local problems, but also looking outward to face the big challenge of managing the sexuality of young people. Overall, that is a common problem for all of us at the global level. And when you look at what WHO is trying to do, for instance, is to make sure that there are available evidence-based interventions, indicators for the interventions, and so helping out to countries to shape their programming, giving out guidelines, standards which should be incorporated in our service deliveries, and values if we are going to program effectively for young people.